Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. From Mumbai, the results of the first serological survey conducted in 3 different wards of the city are out, and they paint a rather interesting picture. This is what we know so far. We know that based on the samples taken from these 3 wards, slums of the city were much more directly impacted, worse impacted than non-slums. This could be, of course, because of high density of population, or could also be because of common toilets like we saw in Dharavi. So this is what the numbers look like. 57% of slum residents were found to be seropositive. The numbers found seropositive in non-slums was significantly less. Interpreting the data seems to point, at least according to the press release from Mumbai's BMC, that while there is a widespread prevalence of the virus, the infection fatality rate is quite low. To make sense of all of these very medical sounding terms for lay people like myself and you, we're joined by 2 people who were associated with conducting this survey, Professor Ullas Kolthur and Dr. Sandeep Juneja. Ullas, if I may start with you. You know, if I were to look at this very simply, and you have to correct me if I'm wrong because I'm not a doctor, but I'm just somebody who's been covering the story now for a really long time. Here's what I understand. It says to me that a large number of people have been COVID positive, are or were possibly asymptomatic, and are not currently infected. In other words, they've maybe recovered on their own without any medical intervention. So that says to me that the infection may have been wider spread than we thought, but the fatalities are not as high as we feared. Would that be a reasonable conclusion, Professor Ullas?
Yeah, so that's one conclusion that we can draw. If you compare both the reported cases and the reported deaths from BMC records, yes, your conclusions are right. I mean, it does paint an interesting picture of how high prevalence is still causing or leading to lower infection fatality rate.
Now, explain the difference, Ullas, between the infection fatality rate and the case fatality rate, because the BMC's own press release says that the case fatality rate is 5 to 6%, and the infection fatality rate is 0.05 to 0.1%, which is really low. First, in simple non-jargon terms, what is the difference, Ullas, between a case fatality and an infection fatality?
So is it okay if I can ask my colleague Sandeep to answer that?
Please, Sandeep, let me take that to you.
Yes.
So infection fatality rate is, okay, you count the number of people who have infection. We tested their blood, we found antibodies on them. So that's the denominator, and people who died is the numerator. So it's a fraction, it's a chance that if you got infected, whether you will, whether you survive or not. Case fatality rate is if you had a reported case, if you had severe symptoms, you went to the hospital, amongst those people, what fraction ended up not surviving? So that's 5 to 6%, yes.
So Sandeep, if I were to make that even simpler for people to understand, it basically means of people who are coming forward and saying, I think I have COVID, please test me, hospitalize me, etc. 5 to 6% of those have died. But there is a large mass out there who probably never knew that they had COVID, and recovered quite well from it. Would that be a reasonable argument?
That is absolutely correct, yes.
So actually, the prevalence of antibodies, because that is what the serological survey is, the presence of antibodies in such a large number of people, 57% in slum residents of 3 wards of Mumbai, says to us that a much bigger number of people were COVID positive than our testing revealed, but much fewer were dying from it. In other words, the absolute fatality rate or the absolute lethality of this virus is not as dire as we thought. Sandeep, would that be fair?
That's very true. So it's actually a very positive result to take from this. What's also interesting and worth keeping in mind is this fatality rate is actually very low in the slums compared to
Yes, I was going to ask that. Is there a suggestion that those who live in slums, Ullas, if you want to take that our poorest citizens in some ways are our hardier citizens, much like, when we eat off the street, our tummies go for a 6, but when so many other people do, they're absolutely fine. So there is something about the hardiness, perhaps, of those living in the slum areas? Ullas?
Yeah, I mean, that's a very interesting question. So there could be multiple factors that are contributing to this.
Yeah.
One is probably the hardiness that you're talking about. Possibly they're exposed to many other infections and maybe their immune systems are working better. The other reason could be, particularly in Mumbai slums, attributed to a younger population. It's generally assumed that slums in Mumbai have a slightly younger population than the non-slums. The third factor could also be a possible skew towards maybe lower prevalence of comorbidities in slums than in non-slums. So it could be due to multiple reasons, but it's actually, in a way, good news for the population with such low mortality rates.
Now, in the beginning, when serological kits were used and the antibodies tested was suggested by epidemiologists, the testing kits themselves were giving very uneven results. They were not considered guaranteed or safe or accurate. What is the margin of error in these findings? Either one of you who wants to take that. Sandeep, let me put that to you. What is the margin of error?
So one thing is, this is, so we are using this Abbott's kits for it, and they've been tested independently to have sensitivity of 93%. What that means is that if you're positive, you might be reported as negative 7% of time.
Yeah.
That means that the prevalence that we are measuring is actually a lower conservative number. It could actually be a little bit higher.
Right.
Now, along with that, I guess you're saying how much is the, when we say 57%, keeping this into account, what will the number be? About plus minus 3%.
Yeah.
So between 54 and 60%. And then on top of that, you build in the fact that you're actually having, some positives are coming out negative, then that you just increase the number by another 4-5%.
Okay, I just want to welcome to our discussion now someone else who has also been associated with the survey, and that is Dr. Jayanthi. Dr. Jayanthi Shastri is, of course, with the Kasturba Hospital, and she's been somebody who's also been involved in the survey. Ma'am, what do you make of the findings? 57% of slum residents seropositive and 16% in non-slums. In a way, it's good news because it means that the bulk of people who are getting infected are actually recovering even without needing hospitalization or medical intervention.
Yeah, actually, this is really good news because the thing is that there has been a whole lot of asymptomatic infection, and this asymptomatic infection has really caused low infection fatality rate also. And because of that, we have seen that in the slums, they have all been exposed to the virus. And the sero survey has been very important in capturing this information.
Yeah, and Jayanthi, what do you think it says for the whole debate around us under testing? One of the big debates has been that the testing rates in India have just not been big enough. Now, this seems to suggest that more than the RT-PCR test, people on their own have developed antibodies. They've been exposed to the virus. Their viral role, in any case, stay at home means very little in the slums of Delhi. I think you're also feeling confident to take off your mask now, Jayanthi. I think after this survey.
No.
I'm joking. I'm joking. It was just a joke. It was a harmless joke. It was a harmless joke. No. I was for all our viewers, please wear your masks when you interact with other people or go into crowded areas, even inside your homes when you're interacting with people who you're not sure maybe positive, do wear your masks. This is not to let your guard down. But the more serious question, Jayanthi, the debate around under-testing.
The
debate around the fact that we've been under-testing. Does the findings of this answer that once and for all?
No, it doesn't. Because how will you test an asymptomatic? So these are all asymptomatic infections. And as we have said in our report, it is the symptomatics who were just removed from that area and they were put in, the quarantine facilities. So it's basically, these are all asymptomatic transmissions which would have gone undetected. You're not going to test them. So
in a way for people, and I want to ask all three of you this, Sandeep, I'll start with you. In a way for people, who don't understand this in a calm way, this may alarm them. How do we tell people you don't have to be alarmed? Yes, 57% of residents in slums were found to be positive, but actually they recovered on their own. What people don't know is how should you be dealing with someone who's an asymptomatic vector? So that person may not be hit, but I may be exposed to the virus and my body may respond in a much more vulnerable way. Sandeep, I'll take that to you first.
I guess, yeah, I mean, that's true that anybody who whether they're asymptomatic or symptomatic, we don't know for sure right now if asymptomatic people cannot transmit the disease. So every common person has to take precautions. You need to keep safe distance. You need to wear a mask. That goes without saying. And these numbers don't tell you not to do that at all. But there is some comfort, as we said, that, okay, the disease is not as harmful, as lethal as we thought. And since it's more prevalent now, you do feel that, okay, maybe there's an element of things calming down for the city of Mumbai. And that's a good point. And that also means you can start opening up a bit more.
So let me ask the elephant in the room. There's been a lot of debate over herd immunity, and some epidemiologists have argued that when a wide section of your population is infected, but fewer people are dying from it, those are the beginnings of herd immunity. Jayanthi, Ullas, I'll take it to you, Jayanthi, first. Do you think that this serological survey is pointing towards herd immunity or the beginnings of herd immunity?
Almost yes, at least in the slums.
Explain that.
Because if you see the early reports which have come out, depending upon the R0 of the virus, it was said that 60% of the population needs to be infected in order to call it close to herd immunity.
Yeah.
Now, which is that magic number? Nobody knows. But I'm just, quoting very senior epidemiologists who had said this.
Yes.
So, having used the best test, that is the chemiluminescence, with a very good sensitivity and specificity, we are very sure of our report and our prevalence, which we have, got in this study.
Yeah.
So I feel that in the slums, this is very good news. So we are saying that we are almost near the herd immunity.
That's fantastic news. Ullas, would you agree?
Yeah, so there are three things, right? One is the population density. The second thing that you rightly pointed out at the transmission rate. And the third thing is, of course, something that we still don't know and evidence is emerging is how long does the immunity persist?
That's right.
Right? So, of course, based on purely numbers, one can make some estimates about when one reach herd immunity. But I guess all of this should be taken in the context of how long an immunity persists in the population, right? But there again, there is a debate of whether you're looking at antibody-based immunity or you have T cells also that can give you protection. Now, unless these come out, we will not be able to say whether the immunity persists and for how long. But for sure, this is an encouraging sign that possibly sooner than later, we will reach herd immunity. And in fact, our second round of survey, which we are planning in about a month's time, or actually it's going to be starting in about 15 days, should tell us what is the rate at which the prevalence has changed from our last survey, right?
Okay.
That will be providing data now, which the epidemiologists can chew upon and actually say if and when herd immunity will be reached. And probably this is first time, if I'm not wrong, anywhere that we are showing a difference between slum and non-slum.
Yeah.
A population density dependent prevalence, also a population where you have low mortality and high prevalence, which is extremely useful to make all the conclusions that you're pointing towards.
Yeah. Sandeep, you want to quickly add to that and I'll give Jayanthi the last word?
I just add a few things. So we are talking about this 57% number. Now I mentioned to you, there's some bit of positives you're missing out because of the nature of the test. Also, we didn't really test the containment zones, which are likely to be more infected. The third thing is that the antibodies generally come down. So, some of those numbers we may have also missed out. So all of this points to the fact that we may have actually underestimated with this 57%.
So it could be higher. It could be higher.
Wow. Now, the other thing to note with that story is that, in the two slums, they reached their peak at different times. One peak was a little bit earlier than the other. Yeah. And the third one has not really reached peak yet. Yet all these numbers are very similar, which kind of suggests that there's a convergence happening, which kind of suggests that maybe there's some kind of, plateauing out is going on.
So, Jayanthi, let me give you the last word. With Ullas's health warnings that we don't right now know conclusively how long the immunity stays, right? What is the one big hopeful takeaway for you from these findings? And do you agree with Sandeep that actually the numbers could be even higher than 57%?
See, the most important thing about our study is we are also going to look at the neutralizing antibodies. Now, as we know in SARS coronavirus, these are the total antibodies which we have detected, the IgG.
Yeah.
So as part of the study, the THSTI is also going to look at the neutralizing antibodies. There are early reports which say that, neutralizing antibodies are the ones which are going to tell us how much is the actual immunity amongst the population.
Yeah.
And there are also early reports which tell us that neutralizing antibodies do persist. Now, how long they persist, what is going to be, the level of degradation, that only time will tell us. But at least we will come to know that with this total antibodies, how many percentage of the population have neutralizing antibodies?
Well, I think it would be fair to say that even given what we don't know, the data is actually good news. We should not get alarmed at this high number or that the number may be higher, because it actually tells you, and I think I can see all of you nodding in agreement, that the lethality of this virus is not as acute or as we had feared for large sections of our population. At least that doesn't mean we let our guard down. It doesn't mean we don't take all the precautions. Ullas, quickly, I've got to wrap. You want to add a line there?
The only thing is, I hope this doesn't come as a kind of an excuse for people to let their guard off, because it's still possible for the vulnerable. This can mean a disaster. So we would like to end that on a cautionary note.
That's a good health warning to end on. Dr. Jayanthi, Professor Ullas and Dr. Juneja, congratulations. And it's good to have data in the public domain. I think data will be examined, debated, re-examined, reviewed, but at least it's the beginning of an important conversation. So thank you so much for sharing the results of this first serological survey of its kind, and keep up the good work. Thank you.
Thank you, Barkha.
Thank you, Barkha.